The case of breast pathology, fibroadenitis, treated with homeopathic remedies and supplements. I gave this presentation at a recent MSU convention, and I won a prize for it. Anyway, what I'm thinking is that perhaps they have not really been exposed to alternative and complementary. It was medical, and fortunately MSU have got complementary and alternative courses as well. Okay, so in this case, I was talking about a case of fibroadenitis, which is actually a difficult to treat condition in conventional medicine, even though it is a common problem which can be debilitating for women affected. In this case, reports an alternative approach with both subjective and objective findings to register and monitor improvements in symptoms after intervention is presented. So the method I used was, of course, as I usually do, take a full case, including the history of the complaint as well as other symptoms, nutritional and bowel habits. This is a typical way of taking history for complementary medicine and especially for homeopathy. And since my main modality, my main method of treatment is homeopathy, as well as dietary and nutritional changes, a thorough case taking is important for me. Screening was done using an alpha site 9000, which is a medical thermometry system which employs a science of regulation thermography. This is an FDA approved medical screening, especially for breast pathology. So 2 scans were done, one before the treatment and a follow-up scan 3 months later. The treatment modalities used include homeopathic remedies, which also included mother tincture. And mother tinctures are actually herbal preparations, but when they're used homeopathically, they're very, very dilute, as well as some supplements and dietary modification. So the patient was a 40-year-old Malay woman whose life had taken a negative turn following the symptoms of severe breast pain, which worsened before menses, but were almost constantly disturbing her daily activities as well as sleep. I need not mention that she had already been to specialists and had conventional tests done, and the diagnosis was fibroadenitis. Anyway, this is quite typical for me to see patients that have already gone the rounds. They've already seen all the other specialists, and they will come to me as a last resort for complementary treatment. Anyway, further to that, the symptoms are heaviness of both breasts all the time, pain on the slightest touch, pain on jarring as in a bumpy ride in a car, and tender on palpation. Breast has a lumpy feel with no distinct mass present. And I sent her for an alpha site examination. Actually, I did not send her the first time she came, but I sent her the second time she came. So a whole body functional thermography was done, and this is a bit about the thermography. It registers the skin surface temperature changes that correlate to how organs and systems are functioning. So it is simple, it is non-invasive, it is a whole body analysis, and intelligently direct specific key diagnosis with a possibility of early detection of developing diseases, root cause analysis, and contributing system assessment. So this is how it looks like. Alpha Site 9000. There is a laptop PC with something that is actually a very, very sensitive heat sensitive thermometer, and the body here shows the spots of which the temperature is recorded, and the temperature is recorded twice. Once before challenging with a cold, that means to say we put the patient in front of the air conditioner, and once is before we put the patient in front of the air conditioner. And I can't say much about this alpha site because this presentation, this case is about fibroadenitis. So alpha site here is just a method of um, uh, monitoring the progress of the patient using something other than just what she feels. So it is more objective. So there's research actually on the alpha side, but not exactly on the alpha side 9000 itself, but on thermometry. And in this case, the research that I found was about radiothermometry, and it was found to be sensitive enough to detect breast pathology, but we will not use an alpha site for confirmation. It's usually used to screen whether the patient needs further investigations or not. And according to Dr. Priscilla Salanez, uh, she said, we respect the system since it utilizes mathematics and pattern recognition and intend to run, then they intend to run clinical trials next to their MRI and CT scan. And she was actually talking about the alpha site 9000 itself. So this patient's alpha site reports on June 20th, 2019. So I just highlighted in red the main finding, the main negative finding, which is a severe deficit in detoxification capability. And on the breast, 11 block spots, lymphatic block spots, were in the right breast, and 12 block spots in the left breast. So this is how diagrammatically the patient's alpha site reports looked like in a diagram form. If you can see this diagram, the areas that are different color, like the red, the orange, the very, very dark colors, these are all the areas of something's wrong somewhere, right? The areas of uh, diversion from the normal, from the norm of the reaction of the spots that are tested. Okay, in thermometry, our body, there is a what you call homeostasis, right? So the body will react in a certain way when exposed to cold. In this case, these spots, they did not act in the way that they should. That is why there's something wrong somewhere. And if you can see these red lines, this shows that there is actually something very bad going on. I'm not going to elaborate further on this. Okay, so prescription on the 20th June. Actually, I already started cornea maculatum in May, before the scan. And corneum maculatum is actually one of the remedies in homeopathy that is very useful for breast pathology, not particularly fibroadenitis. In fact, corneum maculatum actually is used in cancer cases. But anyway, one of the symptoms of corneum maculatum is actually pain in the breast before menses. And when I took the case, the patient, she had a lot of suppressed symptoms. So that actually is another indication of corneum maculatum. So I already started this before the scan in May. Before the scan was done in June, so before the scan in May. And when she came back for follow-up in June, I gave her other remedies based on the scan, because the scan showed that she had some very severe lymphatic blockage. So phytolacca is another remedy that is frequently used for tumors and for lymph node swellings. And in this case, the scan showed that the lymphatics were blocked. So I used phytolacca and I combined it with Scrophularia nodosa, another mother tincture, which is often used for lymphatic enlargement. Cardus marianus was also given for the liver, to support the liver. It's an organ remedy for liver. And the reason why I gave the Cardus marianus is because The scan showed that she had a severe inability to detox. Psyllium husk with 2 glasses of water. This was given because of her constipation. She had quite a bad constipation, and I didn't want to give her a laxative, but psyllium husk works as a bulking agent. And another preparation that I designed myself is actually a mixture of gum arabic, baobab, and transfer factor. So the gum arabic works as a prebiotic, plus it has got some pretty good nutrition of amino acids and minerals. And the baobab is another very good fruit. It's a dried fruit from the baobab tree, and it has got a very large amount of vitamin C and other antioxidants, as well as some of the B vitamins. And I combine it with a little bit of transfer factor. Transfer factor is actually an immune booster. So on follow-up, on the 29th of August 2019, amazingly she had no more breast pain, and it was no longer tender on palpation. And she had before that she was complaining of headaches, and she told me that headache is fine, no more headaches, no dizziness, and previous symptoms of blocked nose was still present, but much less. And mentally and emotionally she felt very much more relaxed, and her anxiety was manageable. Still some anxiety left about future events and all that, but she was no longer hot-tempered, and she could express her emotions quite well. So because the way we treat people is quite holistic, so this part of the history was taken before, and I also noted it after. One thing she forgot to tell me, and I forgot to ask, was about her menses. It wasn't regular, and she remarked that now, after treatment and 3 months going, the menses was now regular. All right, and again we did another alpha site scan in August, and she came for her follow-up, and the finding that was before it was severe deficit became minimal deficit. Okay, and I just want to highlight these points. And remember, 11 block spots, 12 block spots, left with 2 block spots, right and left. Okay, she's not 100% cured. There's still something not quite right, but it was only 3 months. And of course, after the second oversight, I continued treatment, especially to address her anxiety. Okay, this was the new alpha site. If you remember the old alpha site, I will do a side-by-side comparison later. If you remember, it was full of those black spots and red and orange and God knows what. So now it is much clearer, and it's looking more normal. And even the red lines, they're reduced to just a few. So now you compare side by side, we can see a marked change in the before and after scan. Okay, there's no manipulation done, okay, because we measured the exact same spots, and the scan results are sent to the US, where it is computer analyzed and it comes back to us. There's no way we can manipulate these reports, okay. So in conclusion, homeopathic treatment improved and ameliorated fibroadenitis symptoms and improved overall quality of life in this patient. The use of AlphaSite 9000 thermometry scan helped me as the physician to identify the lymph lock and to identify the inability to detox in the body, and thus guided in planning the treatment to overcome the issues discovered. Thank you.